Hello and welcome. My name is Chris. I'm part of the Vertica UK team. Thank you all so much for making the time to join us tonight for this, our very first Vertica live streaming event. This is a unique event that we've put together to help bring aspects of men's health to the fore. Specifically, we'll be focusing on erectile health, and with us today is our very special guest speaker, Professor David Raelf. Professor Raelf is a fellow of both the London and Edinburgh Surgical Colleges and a professor of urology at London College University Hospital. Since his appointment in 1996, he's built up the andrology department at UCLH into the most prestigious andrology department in the world, with over 50 international observerships per year and the highest number of tertiary referrals in the UK. The andrology department specialises in penile reconstruction, Peyronie's disease, male infertility, and ED, or erectile dysfunction. Before we begin with today's presentation, a reminder that a recording of this broadcast will be sent to you via email. It's the email that you've registered with. We'll also include a special gift from the Vertica UK team as a thank you for your participation. We understand that anonymity is important, and you should all know that you're completely anonymous to each other today, aside from your chosen nickname or screen name. There is a chat window up on the right-hand side of the screen, which you can use to interact with us throughout the presentation. The presentation will be followed by a question and answer session. We may not have time to get through all of the questions, but we'll cover as much ground as possible. So without further delay, I'll now hand over to our speaker, Professor David Raelf.
Thank you, Chris, and welcome to everyone. And hopefully this will be an exciting new revolution for us in the management of erectile dysfunction. So I'm going to talk about the Vertica device tonight. This is our agenda. Clearly, you've got to understand a little bit about erectile function to understand how this machine works. So we'll talk about the basic anatomy and physiology of erections. What are the common treatments that we have today? And then, of course, the future, and hopefully I can then explain how it works and why it works, this machine. Now, it is a common problem, male erectile dysfunction, and it can occur at any age. Now, clearly, in the youngsters that are fit and healthy, it tends to be more sort of anxiety related. And as you start to get comorbidities and hypertension and diabetes, etc., then the incidence of erectile dysfunction increases. It increases, and this is a study that we all use in our field, just showing you the age and the incidence of erectile dysfunction. And you can see over 50 years of age, to 16%, depends which country you're in, may have a degree of ED. Now, I think all governments realise that this can be a big problem for them because it's going to cost money to treat these patients. And you can see this is just up to 2025, next year, the number of men with erectile dysfunction, 300 million and rising all the time. And it doesn't really matter which continent you're from, it's a common situation that ED is present. So how does it work? First of all, let's talk about the erection itself. You can see on this side here, this is a patient with a flaccid penis. You have the neurovascular bundle on the top of your penis, and this supplies the sensation to the glands. The urethra on the bottom for your waterworks. And then the powerhouse, of course, in the middle, the erectile chambers consisting of a lot of collagen, smooth muscle, and obviously blood vessels. And when it's all flaccid, everything is contracted. And then on this side, when the nerve signals come through, you then have dilatation of the smooth muscle and of the blood vessels to get more blood into the penis. When you do get more blood into the penis, of course, the pressure inside the penis starts to increase. And as the pressure increases, it traps the blood vessels which drain the penis so that the blood is then contained only within the penis, and the penis is then erect. So in other words, you need an increased blood flow. You need relaxation of the muscle to accommodate the increased blood flow, but you need to stop the blood from escaping from the penis, called venous occlusion. And there are some conditions where this breaks down, and we'll talk about that a little bit in a minute. All of you listening tonight will realize that the quality of life is impacted with any degree of erectile dysfunction. Not only does your confidence and your self-esteem deteriorate, but remember there's someone else involved in this, particularly if you have a partner. They may feel that perhaps you don't find them attractive or desirable, and they may then blame themselves. Loss of intimacy is a common thing that happens in this situation. And, you know, in prolonged degrees of erectile dysfunction, then of course you have impact on the work, the family life, and of course when you get into depression, that can actually affect you in many ways. So it's probably best to take patients seriously, treat the patients, and hopefully some of these aspects here will be improved. Depending on the age of the audience, some of you may remember some of this, but in the early days we didn't really have much treatment for this condition. Everything was called psychological. There were some primitive vacuum pumps in the early 60s and 70s, and I guess penile implants came a vogue in the late 1970s, 1980s. Primitive, and they're very good now, but of course this would be considered end-stage treatment. In other words, everything else has failed before you get a penile implant. There were some revolutions in the 90s where we understood the mechanism, and self-injections with prostaglandin and various other agents that we still use today, but this would be considered second line. And the major thing, of course, was in 1998 when Viagra was launched. You could now take a pill, and of course this is much more acceptable to our patients than having to stick needles in their penis or put a vacuum pump on their penis. But of course you can see that's 1998. So we're talking about 25 years or so of no real change. And so hopefully now in the 21st century, we're going to have future treatments which will be even better than Viagra and some of the PD5 inhibitors. Viagra is just one. It blocks the PD5 enzyme, which is responsible for erectile function and keeping the muscle and the blood vessels dilated. And you can see in the market there the reasons why patients after 1 year drop out. So only about half of the patients continue to take the medication after 1 year. And there's various reasons. Either it doesn't work, or they're not allowed to take it if they're taking nitrates or certain medications, for example, or they just don't like the idea of taking a pill to actually have sex. It's all sort of programmed sex, and particularly the partner doesn't like the idea that the man has to take a pill to actually have sex with her or him. So the mechanism of action of these pills, as I said to you, they work by relaxing the muscles inside the penis. You have stimulation, sort of nerve stimulation to release the neurotransmitter nitric oxide. And all of this process obviously is self-limiting, and these products get broken down, and the Viagra medications, the PD5 inhibitors, inhibit the breakdown of these chemicals. So you can have an erection for longer and stay erect and continue sexual activity. There are some limitations, however. It depends on what medication you're taking. There's only obviously a time period where these pills are active. So, for example, with Viagra, it's 4 hours. You have to obviously take it on demand. But one thing that the patients will say, it's treating the symptom, of erectile dysfunction, but it's not curing me, and I'm going to continue to have to take this medication. I may have side effects, particularly headaches and indigestion, facial flushing, and some people can't take them because of the side effects. And then as with time goes by, the effect perhaps wanes a little bit. They have to increase the dose, and then we have the situation of PD5 inhibitor failures, and what next? So there are some limitations. As I said to you, that 50% don't take it after a year, and this is not just Viagra, it can be the Cialis. There are obviously generic treatments of these names now, which are much cheaper, but it's still the same medication, and you take it 30 to 60 minutes prior to planned sexual activity. And to some extent, this is what the patients and partners don't like, the planning of actually having to take a medication to have sexual activity. These days they are prone to abuse, recreational use, and certainly now that they're over the counter, it's easy to get hold of these medications, and you take it with alcohol, perhaps some other recreational drugs, and there's then a problem with priapism, an erection which you can't get rid of, and that's quite dangerous. And so we are seeing a lot of the misuse in the club scene. So what do the patients want? Well, clearly, if you've got a treatment for erectile dysfunction, it's got to be effective and safe. If it wasn't safe, it wouldn't be licensed. You don't really want any contraindications, but I think one of the main aspects is the spontaneity. Sex is all about spontaneity. It's much more enjoyable if it's spontaneous rather than planned and programmed. Yes, if you could have a cream that you rub on the penis, then the patients would like that. Unfortunately, none of the creams really are effective, and so that rules that out. And it has to be cheap and affordable. What they really want, of course, is to be back to normal. In other words, they want a cure, just like in all aspects of medicine. I want to be cured of this, not just maintain my treatment with medication. I want to be cured. Doesn't matter what disease. If you can be cured, that's what you want. And this is where we talk about regenerative ED medication. You can see on this slide there are different types. You may have had shockwave therapy, for example, which has been around now for about 10 years or so. Then there's the P-shot or PRP, the platelet-enriched plasma with all the growth factors. Stem cells is a big buzzword, but of course there's no information really on that. And to some extent on PRP, we don't really have any information. So until we do, I certainly don't recommend that. And so what I'm going to talk about now is radio frequency, which is part of, is the therapy Vertica. Vertica versus the blue pills, where we are now then, because obviously the pills are the #1 treatment at the moment, treating the symptoms, but it's not a cure. And so perhaps this is what patients would want in the future. So where does Vertica, which is obviously radio frequency, and I'll talk a little bit about that, and the heating of the penis, causing an increased blood flow, as you would expect. If you heat anything, you're going to get an increased blood flow. But likewise, it's going to help with trapping that blood, venous occlusion in the penis. So any of you that think that you might have that commonly is known as venous leak, we call it veno-occlusive dysfunction in the field, but patients often know it as venous leak. Hopefully then Vertica will treat both. Certainly the blue pills don't treat venous occlusive disease. So here you can see them. It comes, there's Vertica itself, which has been around for many years now, and the Vertica Plus just recently been introduced with some of the improvements, which I'll talk about in a little minute's time. It's going to treat the cause of erectile dysfunction, and we're not saying it's for every single. I mean, you can have some really bad causes of erectile dysfunction, but certainly in the vast majority, which is vascular, it's going to improve blood flow and venous occlusion, which is what I told you was the mainstay of the erectile event, and hopefully therefore long-term improvement. And if we can regenerate tissue, and the tissue responsible for erectile function, so the collagen of the smooth muscle and likewise of the vessels and the tunica, which is the encasing of the penis, then of course erections can improve. So it's improving the tissue that we have there already to actually improve and cure erectile dysfunction. Vertica is obviously one way of doing this. It's going to obviously involve long-lasting benefits and hopefully replace the need for any medication or any other treatment that you have. Because this is what we're going for. We're going for this is going to cure your erectile dysfunction, and the more you use it, hopefully the more collagen is going to be formed and the better the results. You can see a picture of it in the slide there. It's pretty non-invasive. It's very safe. You can use it yourself in the privacy of your home, and of course you can decide how long you want to use it depending on how much time, and it addresses the root cause of your erectile dysfunction, and hopefully you'll have a long term. And I'll show you some data in the early studies to show this is not just a short-term treatment, it's a long-term treatment. And of course you can top up as you go along. You've got it, you've purchased the device, it's at home treatment, and you can then use it as you wish. So this is just really a summary slide on first line therapy we have today, which is PDE5 inhibitors versus the Verticare. And the main thing, of course, is that it's treating the cause rather than the symptoms. Hopefully, it's going to be long lasting. We have data going up to 1 year now, whereas obviously the PDE5 inhibitors, after 1 year, 50% of the patients aren't using it anymore. What about shockwave therapy? This is another regenerative medicine. You have to, unfortunately, you can't take this home. They are big machines that you have to go and get various numbers of treatments. Shockwave of the penis, it's again relatively safe, doesn't cause any problems for you, but you would have to go and have the treatment. You can't really have, well, you can have top-ups, but you're going to have to go and pay for more therapy. Whereas, of course, with the Vertica, if you've got a home treatment, then you can use it when you want and when it's convenient for you. They work slightly differently. Shockwave works by blood vessel regeneration, the Verticare by vessel regeneration and collagen fiber renewal. So you're talking about the tunica of the penis, but also the smooth muscle. So there's many aspects to actually having better erectile function. So you're not going to the doctor. You go to once, you try the Verticare, and then of course you're on your own. And so this is an advantage. So let's have a look at the Vertica machine itself. This is the console. You can see it's quite easy to use. In fact, it's very easy to use. I'm sure your doctor can teach you because they'll have some demonstration models in the clinic. But you can buy this online and you'll get started and you'll know how to use it very quickly. So it's a target. How does it work? It's targeted. Basically, it's heat. Heat by radio frequency waves, targeted at not just at one specific spot, but over the whole penis. And if you heat up to, well, you can go any sort of 44, 45 degrees centigrade, you're going to increase the penile blood flow. You're going to get engorgement, and of course it's just going to encourage natural healing processes. It's flexible. You can use it usually in the sitting down position, as you can see here. I'll just with my cursor show you this is the device. So the penis is put through the ring here in the device, and you have these pairs of probes which are generating the radio frequency waves. Now you can see at the top at 12 o'clock and 6 o'clock, you've got probes there which stabilize the penis, and it's very comfortable to use. And so these will not be generating, because here, of course, you've got the neurovascular bundle, and here you've got the urethra. And what we want to do, of course, is put all the energy inside of here, the erectile mechanism, and hence you can see that these will then alternate, and you'll get then even distribution through the whole penis. And you can move you'll spend a small amount of time at one area. You can then move the device up or down the penis so that the whole penis gets treatment. And you can see on this particular side there's a little strap there that attaches to the device, and the pad can then go onto the perineum, so that you're treating the penis underneath where you're sitting down. So the whole penis is getting the treatment, not just the shaft that you see in day-to-day use. So it has sustained results so far, lasting improvement. It's very convenient because I said you can use it at home. It's extremely safe. We have had no adverse events and patients complaining of any problems. It's extremely safe. And as you can see, compared to other treatments, you don't have to inject your penis. You don't have to take a tablet when you want to have sex. Hopefully, this after a few weeks, you're going to notice the improvement, and this is going to be a lasting improvement. As I said, so far we know at least up to 1 year. And if you want to just top yourself up, that's absolutely fine. If you've got a spare 15-30 minutes, then by all means, have your session. You can have it at any time. You can have it at night time. You can have it during the day. It doesn't really matter. You can never have too much of this. And as you can see from the data we have, you start to see some improvement even as early as 2 weeks. Now, this is the original trial. The IIEF, the International Index of Erectile Function, is a questionnaire that we use for all erectile dysfunction treatments, including Viagra treatment many years back. And you can see over 26, if you score over 26, you don't have erectile dysfunction. And you can see the baseline of the 28 patients that started the study was 16. And after a month, there's a big increase by up to 7 points at 1 month. And this is the encouraging aspect of things, that this was maintained. This is at 8 months, but we have more data out at a year, that actually they're actually going to almost normal, not only a month or two after starting it, but actually maintaining that. Now, appreciate some of the patients may want to top up, and so you're having continual top-ups, but at least you can say that you've got normal function going up to a year down the line. That's the questionnaires that the patients fill in. The other thing that we look at is how hard is the erection. You can see the scale, and again, this is what's used in clinical trial data all of the time. And of course, at a level of 4, your penis is completely rigid, and you can see that it was starting down. It was not really hard enough for penetration, and then as time goes by, the hardness of the penis was getting more and more, and at 8 months or so. So that's quite encouraging data. Clearly, we need more studies, and there are now clinical trials in the US to get approval there. And so you're going to get many patients with more data, and this will then spill into the scientific community to actually start recommending it to all of our patients, not just the lucky few that are involved at the start. So this is how you use it. First time, 3 times a week for the first month, and then start to reduce. So twice a week for the second month, and then as needed once a week. And then again, as I said, you can have top-ups whenever you feel that you need it. It doesn't cause any harm to have a top-up. You've got a once-in-a-lifetime machine. You're only going to buy it. It's going to continue using it. You can just recharge it and have another session. And each session takes about 30 minutes or so, so it's quite convenient to use. You're not having to go to a doctor to have the treatment. You just do it at home in your own privacy. So what you should expect, that your early morning erections, of course, if you've got better quality tissues, your early morning erections are going to improve, and likewise your rigidity after a couple of months, and then hopefully after 2 to 4 months, and then going forwards from that, this is when we're talking about perhaps back to normal. As I said to you, there is a newer device. I mean, as you would expect with this technology, things are going to improve, and then another device comes out, and so you'll get more and more improvement, because the companies, they're always looking to improve. And this is a device, same radio frequency, same device, but actually you've got guidance now for a smartphone or any gadget, so that you can actually see how you're doing it when you're giving your treatment yourself. So am I doing this correctly? Am I doing it in all aspects of the penis? How much power, how much heat? It's all recorded. And if there's any problems, this data can be relayed to the company, and they can give advice. So it's just helping you to deliver the energy and to use the device in a correct manner. So in summary then, this is hopefully a breakthrough in treatment. Things happen by accident. And hopefully we've stumbled on this treatment as a groundbreaking treatment to cure erectile dysfunction. And of course this will come at some stage, so perhaps it's now. It's going to improve inflow, stop that venous leak or veno-occlusion to improve it, regenerate the tissues, and of course this may be taken further in other aspects of sexual medicine, and hopefully then have spontaneous erections. You can see it's easy to use, with very safe at home. It's got approval, and of course if to get approval, it's got to be safe and it's got to be effective. And of course, if you want to, you can combine it with other therapies, particularly if it means you're not going to get a penile implant. So this could be also good. There have been some testimonials, of course, and this is unbiased. This is from Trustpilot. So these are patients. Companies have got nothing to do with any of this information. You can see you've got a 49-year-old patient on one side with moderate ED, which has been there for a long time. And once he was taking the Vertica, he realized the speed of recovery of his erections. And you get all these different, I mean, really encouraging testimonials about this. And you'll see this also in the newspapers, which have now caught hold of the fact that there is something new out there. So, for example, the Daily Telegraph is in the UK, the Times, for example, they've all cottoned on that there is actually a new treatment for erectile dysfunction, which will be long lasting. First erection in 27 years, so it's never too late to start. And so why not try Vertica or Vertica Plus? Hopefully, as I said, with more data coming through, we'll be able to then have placebo-controlled studies to prove that it actually works as we feel it's likely to do. Thank you very much.
Thank you, Professor Ralph. That was extremely informative. A huge amount of information there for our viewers. So a good opportunity to remind you, if you're watching live, you will get a recording sent to you within the next 24 to 48 hours. So please keep an eye on your inbox, and included in that email will be a special gift from the Vertica UK team as thanks for your participation today. So, Professor Ralph, we've got time for a few questions. I'll first of all go to the questions that were submitted at registration. So let's begin with, will Vertica help with ED resulting from a radical prostatectomy?
Well, I think treatment of erectile dysfunction after radical prostatectomy is universal to varying degrees. And at the moment, we're talking about regeneration. And we're giving PD5s on a daily basis, which hasn't really had any scientific proof that it works. So we're already talking about regeneration of nerves. And so if you've got, we haven't got any data using Vertica, but if you want regeneration of perhaps the nervous tissue as well, then and veno-occlusive dysfunction, which of course happens in this condition, then it might be of benefit. So there will be studies looking at ED after radical prostatectomy. And if it does work, it's going to work quicker probably than waiting 1 or 2 years that we have to at the moment with PD5 inhibitors.
Okay, thank you very much. How does Vertica impact with somebody with Peyronie's disease?
We don't know the cause of Peyronie's disease. It's been around for about 500 years. But what we do know is it's a collagen disease. And so if we have a treatment which is improving and regenerating collagen, then with any luck, if we use it in patients with Peyronie's disease, and again, we don't have any data and it hasn't been done, but there will be clinical trials for that, and perhaps a different type of machine, but the same form of energy, then it may be of benefit in Peyronie's disease. I mean, the patients with Peyronie's are crying out for treatment because at the moment we have no treatment for this condition. The doctors will say, oh, just go home and maybe stretch your penis with a vacuum device or something and then come back later and have an operation. So if we've got some definitive treatment for it, then the patients will be desperate. They are desperate for treatment.
Indeed, thank you. The next question is, do Kegel exercises complement the effects of Vertica?
I mean, Kegel exercises in the perineum where you're basically contracting your perineal muscles to try and inhibit blood from escaping. What we're trying to do, particularly with the pad, remember there's a pad that goes down onto the perineum, is to actually get more blood into those muscles and actually relax the tissues. So to some extent, it's sort of the opposite to the effect. So you wouldn't want to be using both at the same time because you're trying to, I mean, the whole thing is relaxation of the muscles, increasing the collagen rather than forcefully contracting the muscles. So it's sort of would be anti-Kegel, really.
Sure. Okay, thank you. The next question is Vertica helpful in countering the effects of beta blockers, which can cause erectile dysfunction?
I mean, beta blockers just means that when you're sexually active, as I said, you need to have more blood going to the penis. And you're only going to get more blood to the penis when your heart rate goes up, your blood pressure goes up, and more blood is forced into the penis. Unfortunately, with beta blockers, they're designed to make sure that your heart rate doesn't go up and your blood pressure doesn't go up to protect your heart. So unfortunately, you know, the Vertica is not going to make the more blood. You've got to get the blood into the penis, and the heart, unfortunately, in the beta blockers is stopping that. So probably not. But again, this is early days. It may be other medications that it is beneficial, but probably not with beta blockers.
Okay, Thank you very much. The next set of questions we have a group of them around type 2 diabetes. Can you tell us what the effect of Vertica treatment is on a sufferer of type 2 diabetes?
Well, one of the biggest causes of erectile dysfunction, well, in the Western world, vascular disease, but diabetes all over. And this can affect younger people as well with bad diabetes. Diabetes has an effect of obviously causing blood vessel disease, furring up of the blood vessels. It can cause nerve problems, but also it can cause fibrosis within the penis, within that smooth muscle. And therefore it's not effective in dilatation. So there's many effects of diabetes on the mechanism of erectile dysfunction. So if you can improve the quality of the muscle by changing the collagen content, improving the vascular supply to the penis, then of course you're probably onto a winner. So, I mean, this is where shockwave comes in. They say, well, we're increasing the blood flow to the penis by new blood vessel, and they're targeting patients with diabetes. I think this is going to be the same. You're targeting patients that have a physical problem related to the collagen and the blood vessel architecture in the penis. So yeah, diabetics, we would be targeting those patients.
All right, wonderful, thank you. And I think you've probably covered this, but it was a really popular question, so I will just ask, does Vertica address venous leakage?
Well, venous leakage there's two things about venous leakage. Well, the answer is yes, obviously. You've got to get, the mechanism of trapping the blood in the penis is remember, increased blood flow, then dilatation of the blood vessels, of the muscle to allow the blood to stay in the penis, and then the tunica of the penis to trap the blood vessels. As the two layers of the tunica move across one another, it traps the blood vessels. So you've got all of those components, which is being treated by radiofrequency treatment. So the answer has to be yes. And which bit is the most important, we don't know, but the whole thing is venous occlusive mechanism, which is being treated.
Wonderful, thank you very much. We do have some live questions that have been submitted, Professor Ralph, so I shall ask one or two of those if I may. We did have a few around the issue of damage caused by priapism. Is that something that Vertica can assist with?
Well, I think it depends to some extent. I mean, because priapism, it comes in all different forms. I mean, if you've had a full-blown priapism, and remember one of my slides was talking about recreational drug use, because you see these young patients that come in with a priapism after a bit of cocaine and a bit of Viagra and alcohol, and they present late, then their smooth muscle is dead. And I'm afraid even Vertica is not going to revive that, because the whole penis is just like a piece of concrete. However, if you get other patients, for example, sickle cell disease, where you get recurrent bouts of priapism, and then yes, it may help those sorts of patients. But if you've got, that's why I was talking about severe problems. I mean, if you've had a priapism and the whole penis is just one lump of scar tissue, I mean, you're not going to be able to treat that anything apart from a penile implant. But yeah, if you've got these patients with stuttering, and this will be the sickle cell population, then yes.
Wonderful. Okay, thank you. A very popular question again. Is Vertica treatment safe, and does it hurt?
This is something that we do know, and it is extremely safe. I don't think we've had anyone complain of any problems. And what was the other? Does it work?
Does it hurt?
Does it hurt? Well, no is the answer. It doesn't hurt.
Indeed. Thank you.
You're just putting it on for 30 minutes, remember? And I mean, there's guides on the machine to actually tell you how much heat you're giving and etc. But you're not going to leave it on for too long. You just leave it on for 30 minutes.
Yeah, that's right. And there are inbuilt safety components within the device.
Exactly, it will turn itself off. Yeah.
Sure. Thank you. The next one is Vertica effective in regards to low testosterone, and can it help?
I mean, if you've got low testosterone, there's various causes for low testosterone. And then, of course, low testosterone ends up causing erectile dysfunction and lack of sexual desire. You need to treat the cause of the testosterone deficiency, and that's not with the penis itself. So the answer to that question is no. If you've got low testosterone, find out what the cause of it is. If you can correct it, fine. You may need to take testosterone replacement therapy. But again, there are patients who are non-hopers and they don't respond to any pills. They may partially respond to testosterone. And if you replenish the testosterone, you can then supplement it. We're talking about combination therapy. You can give your Vertica. But you've got to have good levels of testosterone. So when you go to your doctor, you of course must, and that's the whole idea of going to your doctor. You have a screening for testosterone, make sure you're not diabetic, any other cardiac problems. So when men go to the doctor, they're going for with ED. It's the first time you'll ever see a man in the doctor. Then there's your chance to actually try and make sure that they don't have any of these problems. But yeah, give them testosterone. If they still need the Vertica, then yeah, that's absolutely fine.
Wonderful. And I think just finally, we'll finish on, I'm 89 years old. I still have a libido, but I'm having other treatment for bladder cancer. Will Vertica be suitable?
Well, the answer to that question is yes. I don't know what treatment this patient or person in the audience is having for their bladder cancer, and there's different forms of treatment. So you can have intravesical or putting chemicals into the bladder. You can have your bladder removed, which will cause more erectile dysfunction, or you can have radiotherapy. And that's another thing, radiation causes fibrosis. That is a real treatment for this particular situation. I mean, we talk about radical prostatectomy and erectile dysfunction. We talk about or for bladder cancer, radiotherapy. Radiotherapy causes fibrosis. And if you want rehabilitation, those are the conditions, because you're not affecting nerves after radiotherapy, you're affecting the tissues and the blood vessels. And so this is where it would be of help. So that's quite exciting. So if you've said to a patient, well, you can have a radical prostatectomy and get erectile dysfunction, you need to do injections or a penile implant, or you could have radiotherapy and have perhaps Vertica treatment, then of course the balance of treatments shift.
Indeed. Well, many thank you, Professor. That's been really, really informative, really useful. Thank you so much for joining us. It's been a privilege. And all that really remains for me to say is to our audience, thank you very much for joining us as well. The broadcast, as I mentioned earlier, it will be transmitted to you via email. You'll also get a special thank you gift. So as I say, Professor, thank you very much. Anybody watching who wants to get in touch can visit the website. That includes Vertica customers. We have our experts on hand and available in the UK from 8 a.m. till 8 p.m. Thank you very much for watching. And from Professor Ralph and myself, goodbye.
Goodbye.